Welcome to the University of Waterloo presentation about our Bachelor of Science in Health Sciences. My name is Pamela Hervid. I'm the undergraduate recruitment coordinator in the Faculty of Health, which basically means I'm the main contact for future health sciences students. All right, when looking at what is health, Waterloo uses the World Health Organization definition of health, which is that health is not merely the absence of illness or injury. It is a state of complete physical, mental, and social well-being. So our faculty has a mandate to prevent illness and injury, promote health and well-being, and improve the quality of life for individuals and communities. And our different programs look at that in a different way. When we're looking at Waterloo's approach to health, we do require a comprehensive approach. So I'm going to use an example that's near and dear to all of us, COVID-19 pandemic. So when we're looking at all the different approaches that need to be taken in order to manage a major pandemic, we use the following kind of strategies. So first we have to treat disease. So we have people on the front lines like paramedics, doctors, nurses who are treating disease, as well as researchers developing pharmaceutical products or vaccines to treat or prevent the illness. And that's an important part of it, but it's not the only piece we need to do. We also want to prevent people from getting sick or prevent the hospitals from getting overwhelmed. And so that's where the prevention aspect comes in. Things like government policies in place, things like encouraging hand washing or social distancing. Those types of things are important as well. Finally, we need to look at who is most affected by the disease. Maybe older adults could be most at risk, or people with compromised immune systems. We even see some concerning factors with people with certain socioeconomic status who are adversely affected more than other populations. So we need to consider all of that and work to protect everybody. Finally, we must use effective methods and understand an evidence-based approach to make sure that what we're doing will have the biggest impact. All right, when we're comparing our kind of two main health-related majors, our health sciences versus public health, which are both offered by the School of Public Health Sciences, there's a couple key differences. So health sciences is a Bachelor of Science, whereas public health is a Bachelor of Public Health. So one important difference is students in health sciences are required to take certain courses like biology and chemistry from our Faculty of Science, whereas public health students are not required to take those science level courses because it is not a Bachelor of Science. Within health sciences, it is excellent preparation for clinical health professions that do require a number of science courses, things like medicine. But it also gives them students preparation to pursue careers like in public and population health, because they also look at how to prevent disease and work with individuals and communities. Whereas in public health, it's more of that community-based focus and not so much as on the individual level. All right, a little bit more about our Bachelor of Science program. So this program is for students interested in positively impacting the health of both individuals and communities through things like clinical health or scientific research. And it's important that students have a strong foundation in natural sciences. When you're looking at comparing programs across Waterloo and maybe other institutions, you might be wondering, well, why would I choose Waterloo for this program? One thing that we like to share is that our graduates do extremely well. So most are in professional or graduate programs or starting their career within 1 year of finishing the program. We actually reach out to our graduates a year after they finish to see what they're up to, and we post that information online. So it's interesting to see what kind of entry-level jobs people are getting from this field, as well as which professional and graduate programs they're choosing to pursue. We've been doing what we've been doing for over 50 years, which means we've had a lot of time to grow both our reputation and do really well in the field. For one example, we're #1 university in Canada for research. So we have a lot of research funding and professors involved in research programs at Waterloo, and especially in our School of Public Health Sciences, as well as we have a lot of course options available to students being a larger program. So we have over 30 specialized upper year health courses that students can choose from depending on their interests and career goals. At Waterloo, we're also really focused on experiential education and getting as many skills and experiences as possible so students are more prepared to go out after graduation. And so one of the ways we do this is by offering co-op, which I'll talk about in a few minutes. For students who aren't in co-op, we have an Edge Experience certificate which gives them the opportunity to take professional development courses and learn how to articulate how the skills and experience they've gotten through their 4-year program make them an attractive candidate to employers and further schooling. We also have lots of small tutorials and labs starting in first year where students are in smaller groups of about 30, where they work through a lot of case studies and real world examples and discussing how the theory they're learning in class can be applied in the current industry. Okay. A good example of experiential learning is this class. This was a 4th-year advanced social determinants of health class. And so this professor, Dr. Anthony, would regularly take her students on field trips. So on this particular field trip, they actually went to a soup kitchen and to learn more about different community supports for people who are homeless, as well as where they were accessing things. So on another field trip, they went and looked at a safe needle exchange. And on a third one, they actually went to a police station to see what things look like behind the scene as people get brought in and are processed there. So really understanding what factors are at play that can affect health that are a little bit more than just what our genetics and biology makeup is. Right. Continuing with the experiential learning theme, I'll talk a little bit about our 2 streams. So when you apply to the program, you'll pick if you want the regular 4-year stream or the 5-year co-op stream. So the regular stream is a traditional program where you take courses from September to April, you have your summers off, and you graduate in 4 years. Students are attracted to that option because it gives greater continuity in your social life, any part-time jobs or extracurriculars you're involved with. And it gives you flexibility in your studies because you're not kind of coming and going every 4 months. And like I mentioned earlier, there is a certificate program called EDGE where you can access some professional development courses and work to gain some extracurricular experiences as well and kind of package that together. We do also have co-op available, which adds an extra year onto your degree, so it becomes a 5-year program. It's still 8 semesters of academic study on campus, but spread out over 5 years. And in co-op, you're alternating 4 months of study with 4 months of paid work experience related to your studies. So students who choose co-op tend to like that they can try something different. They can work for a different employer each time. They earn a little bit of money to help cover some of the costs of their education. Students earn between $8,000 and $13,000 per work term. Although it can be a bit more stressful because students are actively competing for jobs and applying for them from our database while they're taking a full course load. Students can also arrange their own job, and we have many supports in our Center for Career Action and advisors who will do resume writing workshops or cover letter writing workshops, mock interviews, and supports like that. We do also have an extra fee for students in the co-op stream. You're not paying tuition for your co-op terms, but each academic semester before a co-op term, you'll pay an extra fee. It works out to about $3,500 over the course of your degree, more expensive to be in co-op, but because of the amount students earn on their work terms, this isn't much of a barrier for most students who are interested in this option. So in terms of co-op, this sequence chart should give you a good idea of how it actually works. So your first year in health sciences, you just come in and you study from September to April. You have that first summer off. And then starting in second year, you just start your alternating 4 months of study and 4 months of work. Again, those 5 work terms, you can go back to the same employer or do a different work term or employer each time. And then you don't have a full 4 months off after that first summer. So depending on the dates the employer wants you to start and end, and when classes start and end, you may have a week or 2 between a co-op work term and a study semester, but it will depend on the semester. All right, so this is Rachel, and she did a couple co-op work terms at Sunnybrook Health Sciences Center in Toronto. She really liked that co-op opened the door for her to work there, and she actually helped do oncology research, which was then published in medical journals read by doctors around the world. So that really looked nice on her medical school application, and she's now in medical school. So she liked that co-op kind of gave her this opportunity she might not have had otherwise, although we do have students who are in the regular stream who pursue really amazing opportunities independently through summer jobs and similar pursuits like that. Okay, so if you're wondering, what can I do with a health sciences degree? I would say a A significant number of our students use it as a stepping stone to clinical health professions or in the healthcare field, things like going to medical school to become a physician, occupational therapist, speech language pathologist, working with clients in healthcare, basically. We're also seeing an increasing number of grads who use it to go into the business and technology field. So, working as analysts, consultants, or product development advisors. There's a lot of private industry out there that looks at healthcare solutions and maybe sells solutions to hospitals, for example. So that's another sector because our health sciences graduates understand the healthcare system and how all the systems work together. We also have many of our graduates go into government and social services, especially on the public health or epidemiology side of things. So looking at how government policies influence health, how to track disease in population, how to roll out vaccination programs to people and get them to actually participate. Finally, our students get a strong foundation in research. So we do have students go on to pursue careers, coordinating research projects, leading research projects, etc. All right, so in terms of admission requirements, we have about 200 students come into this program each year. We'll look for a grade 12 English, biology, chemistry, and grade 12 math. And we'll use that in your next best 2 grade 12 URM courses to calculate an admissions average. Of course, this is for Ontario high school students. If you're studying outside of the Ontario curriculum, you can just Google U Waterloo admissions requirements. You can go to our website and you can pick your system of study from the drop-down menu, and it'll tell you exactly what the required courses are that you'll need. In terms of admission average, to be considered for the program, you'll need to have an admissions average in the mid-80s if you're thinking about the regular traditional stream, and at least in the high 80s if you're thinking about the co-op stream. If you're interested in co-op, but you're not quite sure if you'll hit that cutoff, by applying to co-op, you'll automatically be considered for an alternate offer to the regular stream if your average doesn't quite meet the cutoff we use that year for co-op, but it does meet the cutoff we're using that year for regular. In addition to grades, you can also submit an admission information form, which is a supplementary application where you get to tell us all about yourself outside the classroom. So extracurriculars, volunteer work, etc. Primarily, most of the decision for admission to this program will be grade-based, but we do suggest filling out the admission information form as we can use it for some scholarship decisions. Depending on your system of study and whether or not your most recent years have been in an English language school system, you may also be required to submit an English language proficiency test results or not. You can look on our website for more information about whether or not this will be required. Okay, so for more information, I do encourage you, if you have specific questions or you'd like to know more, you can reach out to health@uwaterloo.ca or that phone number there. That actually goes to me primarily, so I'd be happy to connect with you to answer your questions in more detail. We also have numerous events and opportunities to visit campus, either in person or virtually. We run a fall and a March open house each year, so those will be published on our tours and events page once registration is available. And then we have in-person campus and faculty tours running most weeks of the year where you can come and visit, as well as virtual tours. So please consider coming to see us on campus, or if you can't make it in person, then joining us virtually. Finally, we have current students available who are really passionate about their program in the university and love to connect with future students. So there is a form you can fill out to be connected with a current student to find out what it's like from their perspective. All right, thank you so much for taking the time to learn more about health sciences at Waterloo, and I wish you all the best as you explore options to continue your education.